Hello. Welcome, everybody. This is our interactive webinar today, July 17th, 2019. And I'm Libby Kennard with Parkinson's Resources of Oregon. We're based here in the Portland area with satellite offices where I am in Eugene and also in Bend. Before we get started, I'm going to give you a quick tutorial. And so I'm going to let you see a short overview that I have on my screen that will help you understand what you're seeing with your control panel in case you have any concerns or questions as we go along. So I am going to share my screen with you. Okay. All right. So I'm going to review the audio panel and the question panel here, but this should be pretty similar to the control panel that you have. So you can choose to listen through your computer or on your phone, and you click that choice there. If you do choose to call in by your phone, you'll need to call the number that's there and then follow the prompted directions to enter the access code and the audio PIN number. And then make sure your volume is turned on and correctly set on either your computer or your phone. A headset is recommended for the best audio. Note that all attendees are muted, and you should see this muted on your control panel. You will always be in listen-only mode. Only the presenter and I will have our audio turned on. And then you should see the question box further down. If you're having technical issues during the program, I will see that, and you can send that to me through the question box or the chat box, and I'll try and help you. When we get to the end, and it's time for questions, our first priority is going to be given to the questions that were submitted when you registered. Those were given to the presenter in advance. So she might address those in her presentation, or she may do so at the end when we get to questions. You may enter questions into the question box at any time, and we'll try to answer as many as we can. Think about keeping your questions general enough that it's going to be applicable for the wider audience. Sorry, my light just went out in my office because it's on a timer. This webinar is being recorded, and you can access it by going to our website, parkinsonsresources.org, and then clicking our YouTube button there to get to our YouTube channel. Or you can go to YouTube and search Parkinson's Resources of Oregon. These online webinars are just one of the many things that we do. We are a nationally recognized nonprofit based here in the Pacific Northwest with a singular focus of improving the quality of life in our community by delivering relevant, accessible, quality programs and services to enhance the lives of individuals managing the consequences of living with Parkinson's disease. So I'm going to introduce our speaker to you, and we will then get started. Joyce Sjoberg has over 30 years of nursing experience caring for older adults and individuals with disabilities in a variety of settings, including acute hospital care, home health and hospice, assisted living, and also with teaching and training caregivers. She's the founder of Aging Advisors, an aging life care consulting and care management agency. They strive to bring peace of mind to families by both directly improving the quality of life for aging family members and by providing consultation and coaching services for their families. Most recently, she co-authored Elder Care 101, a practical guide to later life planning, care, and well-being. So I will turn everything then over to Joyce.
Good morning. All right, I'm going to click a button here. There we go. Show my screen. All right. Everybody seeing what I see? Good morning. Thank you, Libby, for that wonderful introduction. It's so nice to be here with all of you, and certainly in this format, it's always a little challenging when I can't see all of your faces out there, but I know you're out there, and certainly if there's any concerns or questions as I go along, feel free to send those questions in, and I'll be glad to respond to those. Libby did a wonderful job at introducing me, but I'm so grateful to PRO, Parkinson's Resource of Oregon. It really is an amazing organization and one that our team and our clients have appreciated and benefited from. So as Libby said, my background was originally in critical care nursing, both critical care and ICU, intensive care unit nursing. And then I moved into residential and community care. So I worked as a director at an assisted living and memory care after doing home health and hospice for many years. And since about 10, 12 years ago, I've been owner of Aging Advisors, a local care management company. But I'm also a family member, as I put up on the screen here. Both a daughter to a variety of parents who I provide care and coordination with. And of course, as a family member, you do that with love and attention, and a mother to our two daughters, and have accompanied them as well and advocated on their behalf at medical and other healthcare appointments. And I think it's important to know that we have these skills in our life from our personal life, and we can bring them into caring for others in our lives. And as well, our book, Elder Care 101, was not the sole author, but a contributor. And this is a standalone book that is meant to be a compendium to providing care for someone. All of our authors wanted to create something for those of you out in the community who are trying to do this job on your own, and to provide you a set of resources. So along with the book is a web link that takes you to approximately 80 or 90 standalone forms and documents. And so that's a resource to you too that I wanted you to be aware of. I'm going to talk today about who is my care team and how do I want them to interact with me, to really think about, you know, from as the person with Parkinson's, what do I want? That person with the chronic disease, what do I need and want? And it's, I think, important to think through that and really reflect on who I am. And we'll talk a little bit about, you know, how I want my team to interact and what kind of role do I want all of my members to take. Both, and I'm going to talk today about medical team members or healthcare team, as well as, you know, your personal and family teams. Going to spend a little time about both of them and talk a little bit about advocacy. What does that look like? What does it mean, especially around appointments, phone calls, and more care coordination, kind of urgent care? And then touching on research before we finish with some questions. So we'll start with, what type of team do I want? So I must admit, you know, as Libby mentioned, I've been doing this for now 30 years. It's a little humbling to be able to say that. But certainly I was trained in nursing, you know, when we were asked to wear white caps, and you were in deference, and as a nurse, in deference to the leader of the team, who was the physician. So the physician was in charge. The physician made all decisions, and the patient, and the family then stood by as the physician was in charge and made decisions. And the family really, for the most part, nodded their head. Now, I know there's always exceptions to these traditional roles and models, but generally most people that I observed in my practice as a nurse, initially again in intensive care, where very difficult decisions had to be made by families through the time, was based on this model. But then over the time, that started changing a little bit. We started to say that there was a hierarchy, the patient was in charge, and information kind of came up this chain, but certainly the physician was kind of at the higher level of the hierarchy, and ultimately, they were the ones really informing the patient, and no one else was really to inform that patient. So all of the calls, all the information was to go through the physician. And now, we've really seen in the last 5 to 10 years, and especially as information is so freely available to us, and really volumes of information, more of a spoke and hub model. And so, I have a picture here of a bicycle that the patient, or the client, as we like to call them in our work, is at the center of this model, and information comes through the patient or the client, and all of the individuals, both the healthcare and the family and community members, give input and share that with everyone. And this is really what works for many people. And everyone, is seen as bringing information to that individual and to that situation, to that family. And some information certainly can be different than others. And so there's this challenge and maybe sometimes a tension between both information and as well what people want. But certainly if it's alive and it's organic, that is really a model that works for many people. But ultimately, and we respect that certainly with our clients, that it really comes to the individual to decide, who they want to be, the decision maker if it's not them, and if they're more comfortable having someone else decide. So I think it's important to start with, the type of team you want and kind of who is in charge of making decisions and how you want to get that information. So I started out with who are the members of my team. And certainly for most people, for adults challenged with and living with Parkinson's, their spouse or their partner is right there with them for the majority of the time. And they're helping to learn about the information. They're there advocating on their behalf, oftentimes the primary advocate individual. So supporting that person, helping to get information, helping to do all these various roles. Certainly family members and children are involved as well. It becomes more challenging depending on where people are. And that's why I write on the other side of the screen here, things to consider are when you try and you are bringing your team together, which children are available to you, who's living close to you, who can attend appointments. And certainly with the advent of, iPhones and FaceTime especially, appointments can be a lot easier attended by people from around the world, and certainly in the United States a lot easier. But it kind of goes hand in hand with responsiveness too. If there's more urgent situations going, or there's behaviors that are cropping up, having family members that are farther away can be challenging and not always the best for the individual living with Parkinson's, because there can be often a lack of time, a lag time. And then friends and neighbors certainly, are part of our team, right? So we have close friends oftentimes. Sometimes we have neighbors who are in between friends and or are part of our support system. They could be part of our support system that helps keep our home going while we are out to appointments, or we're out for longer extended hospital stays or overnight stays. We have friends that sometimes act on behalf of our family, our spouse, and or our children if they're not available or they're having their own health challenges. Oftentimes, I've seen our clients with Parkinson's have friends step in and act as their advocate. I'm going to skip over healthcare providers and certainly mention that there's a big part of the team and have a following slide to talk about them. But of course, they're key to this model as well. And then speak a little bit about financial advisors. I always kind of hearken to a lecture I heard at the VA by their head of geriatric medicine many years ago, who spoke to, they have a system now where they ask family members when anyone's been diagnosed or looks like there's a cognitive impairment, they ask all spouses or the primary advocate or support person to fill out a caregiver burden index. They want to know, and they want the family and the client to really understand how the caregiver is doing, because really it's the caregiver that helps that individual live through until the end of their life. And along with that, they talk about potentially the prognosis of that person and what they might be looking at. And so they suggest and recommend, based on that people reach out to both their financial and their legal advisors. Financial for looking at, if you are looking at 8 years, 10 years, 20 years, do you have the resources to currently maintain the level of care you have now? Versus do you need to make some different changes? And better to look at that now versus later. And then legal, which of course goes back to, our power of attorney. Who has the legal and authority if the person identified care receiver is unable to make decisions on their own or able to take care of their financial or legal affairs? Who has the ability to do so? So these are also very important members of our team. We're lucky here in the Portland area that we have a free legal clinic for older adults, for adults and older adults. And it's staffed by a team of elder care attorneys from this area. And certainly that's available to others throughout the community here. But certainly in your communities where you might be living, there's obviously other resources as well. And sometimes you can find similar resources at county offices too. And then I would go along with the VA as well, being part of that kind of financial legal team, because they also have resources through the VA for those of our members of our community who have served in our armed services, an important piece to remember as well. And then we have healthcare advisors, such as our teams, our care managers. There's individuals out there who, caregivers as well, part of in-home care agencies. There's individuals now who are calling themselves personal advocates. So a variety of different professional roles in the community that are providing this type of advocacy and support for individuals. Most often, unless they are through an insurance agency or your insurance, or they're through your physician office who appoints them and bills Medicare for that assistance, like as a case manager, or if it's through a county office, again, those otherwise, most often that's a private pay situation. But there are individuals out there in the community that are providing this level of kind of support and advocacy as well. And then I throw out kind of an other, certainly we have spiritual care, we have clerics and such, we have the person you get your hair done from oftentimes is talking to a variety of people and provides advice and support to you. The person who is on the side of your car and making sure that you have good transportation to and from all the variety of appointments you need. The Parkinson's Resource Organization, their support group and other support groups in the community, whether they're professional association based or volunteer-based. Those are essentially such an important part as well. And then some people who are still working, they have work peers who as well are supportive to them. And I threw in insurance agents too, because they as well can provide some good information and support. Other questions to ask, I mentioned geography. Where people are living is so important. Their ability to respond. So if an adult child or a friend or neighbor is helping out, are they able to come to your bedside if something is happening quickly? It's an important part to remember, who to bring to your team and who do you want with you. And then I talk about emotionally intact. We had one client who had a variety of older children, but two of them were really challenged with some issues. One had a special needs son, and another had had a long history of some drug abuse and alcohol issues and really wasn't available to be part of that team for that family. And so these are things that many people have to kind of think through. Who do I invite to the table to assist me and be part of my team? Although the other side is it can be challenging as a parent to uninvite people onto their team. And so I know there's a lot of thought that goes into, who do I ask to come to the table to assist me? As well, looking at the team members that I'm asking to help me, do they have physical challenges themselves? Are they dealing with diabetes? And if they're in, if I'm in a long test and if I'm getting therapy, and if they're going to be struggling with their low blood sugars, will they be able to really help me? And should I ask them to do something else instead? So thinking through, the other issues other people might have. And then certainly there's relationship dynamics. Some adult children have asked for our support, and I've certainly seen them kind of struggling with, boy, I really want to help mom and dad right now, but they've always been in charge. They really haven't let us step in, even as our parents have aged. And it's hard to sometimes change those dynamics, especially between adult children and adult parents or older and aging parents. So some of these things are so important to just really consider, either just, on your own or to bring it to a family meeting and have an open conversation about. Now, this is a wonderful slide that Libby actually shared with me, and I just think it's so helpful. And it really talks about the members you should have on your PD healthcare team. Who are they, what they do, and when to call them. So we'll just kind of review this, but as Libby has shared, this is available to you as well, recorded. So certainly your primary care provider, that PCP, they manage overall your health information. And some primary care providers, and in Oregon, for example, now with our shared what's called computerized system called Epic, at least the clinics and various healthcare providers in Oregon can access, except for one kind of small system outside of it, but all of the other biggies can see the same information from other providers. And so that's really key, I believe, in advocating too, so that other healthcare providers are not operating kind of in a bubble. They're not operating in a silo. They're able to look at what other providers and specialists are doing on your behalf. And so, but they sometimes need you or who is advocating for you in your appointments or conversations with them. They need to sometimes remind them, I saw my neurologist 2 months ago, or I saw my physical therapist a week ago, and they recommended X, Y, and Z. So it does sometimes still require that you advocate and ask your PCP to look up and look into that information. So, at least at a minimum, Medicare, if we're talking about people 65 and older, Medicare covers an annual health exam. and that's covered once a year. So clearly everyone should see their PCP once a year, and it's usually in their office, made by appointment, and really looking at overall health, as well as Medicare covers for your annual vision exam too. So those two are covered by Medicare as well as Medicare Advantage plans. Your neurologist and your PD specialist are often involved initially in diagnosis and then ongoing in management. So sometimes the general neurologist may work alongside or in concert with a specialist neurologist, one who specializes in the treatment of PD and or movement disorder specialists. You've probably heard that as well. And they will work with you especially when at initial diagnosis and then ongoing as things are changing or new symptoms are cropping up, okay? So generally, for most people, you'll see that neurologist or that PD specialist between 1 to 4 times per year. Again, at their office, and depending on your insurance or your Medicare Advantage, that appointment might have to be referred in by your PCP. Okay, so that's again, back to that's like that spoken hub model. It does take the PCP at the center to refer out to all of these different things. A neurologist, based on Medicare's requirement, a neurologist can't refer in other specialties, but a neurologist can send a note to your primary and recommend that the primary refers out to other specialists, okay? Then you have a nurse. Now, most of the PCP offices have either a nurse or a medical assistant in their office. And see, these are allied health professionals, the nurse, the social worker, physical and occupational therapy. And these allied professionals can either be involved with you either through the clinic or they can be referred in by the PCP anytime. If the nurse is working with a physician, they can be seen, you can be seen by them anytime you're visiting the primary care provider. If the PCP is referring out to home health, then a nurse comes with that package and referral, physical and occupational therapy, and speech therapy too. So all of those therapists or speech and language pathologists are referred in through a home health team. And home health then, unless you are not homebound, then you are able to go out to a rehab clinic, then you're going to see physical therapy, occupational therapy. But if you're in home and need services in home, then those services will come into you. And so you've got the nurse and the social worker as well. More and more clinics are employing social workers. And so your PCP office and sometimes your neurology office will hire both a nurse and social worker to act as a case manager. And they will provide a variety of resources as listed here. The social worker, certainly both counseling, short-term, long-term care planning, assessing what home needs are, helping set up respite. The nurse is more like to help with medication management, referrals to others in the community, kind of information, backing up any kind of training needed, or help with both a personal or a paid caregiver, okay? And then if there is some concern about safety at home, again, the physical and occupational therapist referred in by the primary care can then, the PT and then OT can do that home safety. And they can be looking at fitness. They can be looking at weakness. They can be looking at gait changes and balance. What kind of equipment is helpful? So often we go in, especially with transfers, and suggest a PT referral and ask them to look at, what about a transfer pole? Where should it be placed? Should it be in the bedroom or in the primary chair someone is sitting in all day? Or can we bring in two? An occupational therapist looks a lot more at kind of our activities of daily living. They're also called ADLs, and that includes dressing, grooming, eating, shopping, bathing, and transfers and toileting. And so they look at how we take care of ourselves and look at how we conserve energy and what helps with stress reduction and relaxation, and other equipment to help through the day-to-day experience of doing those ADLs. And then last but not least is the speech and language pathologist or therapist who can help with language when language becomes difficult or challenged, and looking at adaptive devices and equipment as well. I think that's a good slide to kind of keep in track of, and to remember that these individuals are certainly available to you. Certainly in large tertiary communities such as the Portland area and certainly Eugene, these are more readily available, all of these resources. As you get out further and further in the communities, I know this can be a bit more challenging and these resources aren't as readily available. So that either requires, the commute into larger cities and clinics and hospital systems, or exploring whether, a more virtual appointment is being offered by those different providers. And I also think in the Portland area, we have more and more physical trainers, personal trainers, getting specialized kind of training degrees and certificates in different areas as well. So kind of thinking outside of the box at who in your community might have some of these skills and be able to work with, in concert with, asking like a personal trainer in your hometown to call in and work with a physical therapist in another town. You'd be surprised at how many people are open to really thinking of these outside of the box solutions and potential ideas. So different roles of our care team. And I'm just like, not everyone in our relationships can do all of this. And if you do have someone in your life that can do all of this, well, good for you. Many people look towards an advocate and a team member to help advise, to be kind of that person with wisdom. And certainly we look towards our healthcare team to provide that information, to advise us, to provide kind of, well, in your experience, what have you seen? You know me. What do you see in my future? What can you advise me for? And those people are pretty important to be able to give us that helpful information. I write down researcher because it does help to have someone who is skilled in looking up information and always looking through different resources to help research what other options there are, what other approaches are there, who in the community is doing what, who's moved into the area, who has left. So it's not just about treatment ideas, medication approaches and options, but providers as well as insurance changes, your insurance plans and how your insurance plan and what they cover and what they don't changes year to year. So that takes a lot of researching when we're looking at your care team and gathering information. It also takes coordination. So, and that's a lot what certainly we're hired to do as care managers, is to really coordinate and make sure that all the members of the team, both the healthcare and the family team, are coordinating and learning that what is happening, what is being recommended, what is being decided, and then being followed up on. And then all the steps it takes once a decision has been made of a treatment course or a new medication, all of the steps it takes to coordinate to make that happen. And then if there are other paid or unpaid caregivers or volunteer caregivers, to make sure that not only are they aware of those changes, but they're trained and feel comfortable, understand how to follow through on those recommendations. And then as well, have their questions answered. If there are changes and things aren't going well, what do they do? So kind of definitely a teaching role. There's an need for an organizer role, right? Not only schedules are big in organizing, maintaining a schedules of all the variety of, we all have ongoing annual healthcare needs between our cleaning our teeth and getting our eyes checked and making sure our glasses are still working. And to make sure if we're seeing podiatry that our nails are taken care of, if we're diabetic as well, we're seeing our endocrine docs, or if we have AFib, we're getting our PT and INR checked. So many different appointments, and how to make sure that those are all organized in a way that don't overwhelm, that don't exhaust either the person with PD or the caregiver. And so that organization is certainly important, and certainly thinking through the timing of those, like when is the best time to do those? Can we kind of create a schedule that we generally follow, and then organize and schedule in the rest times and the vacation times and the down times, so that we aren't feeling, either of us feeling like we're always out there and staying busy. It's so important to have that rest and downtime. Other roles that are certainly so important is the person who is the empathetic listener, someone who can just hear us. You know, this is a challenging disease, and, you know, things change. We have a lot of information coming in that we have to sort through and think through, decisions to be made, potential changes in the future we might be considering. And so it really helps to have people on our team who can just listen. We don't necessarily need them to make decisions. And I know I've heard our clients say, I just really need someone to listen to me. And sometimes my kids are so busy because they're working and they're raising kids. You know, I don't want to bother them. And so finding individuals who can just listen. Oftentimes members of our church, our spiritual community, can act in that role. And sometimes neighbors are fabulous for this, or the beautician, or the gentleman or the woman you take your car to. But, you know, we do have a community that's out there. It's really just kind of thinking through who does these roles for us. And then there's the supportive, who gives us our hugs and kisses, who prepares cups of hot tea for us, who really, offers us gestures of support that is so helpful too, or remind us we need to take care, we need to slow down and take care of ourselves. And then I note who is the straight shooter. There are times, you know, not all the time in our appointments or working with our healthcare team, that we have to make really difficult decisions. Sometimes, such as, you know, our house is no longer working with the level of mobility changes I'm being faced with. And what do we need to do now? And do we really need to make some other decisions? Do we need to consider Medicaid? And should we be looking at a Medicaid building and facility? And at what point should we be bringing that in? A lot of times families reach out to us just for that. Can you help us kind of really look at and give us some really, you know, straight advice about what is our timing? What are we looking at timing wise, and when should we be considering certain things? And so not everyone can do all of those roles. And so that's important to look at too. And then there's so many other roles. I mean, there's our home and our car. So who's driving us to and from appointments? We have one client whose church group really just says, we really want to be the ones driving, our friend and person with PD to her appointments. That's what we feel like we can do. And so they offer to drive. But then it goes back to the organizer and the coordinator to then work to make sure all of these people are in place to actually do the driving. Our home base needs attention. You know, where we live still needs a lot of attention to support us and provide us the safety and security that we need, and certainly our financial team. And so that's the reason for this beautiful bouquet, which is to look at, we really need a variety of people to provide this care. And every now and then we hear from individuals when we meet with them that are less enthused about either their primary care provider or their neurologist. And in this area, you know, we're fairly blessed in that there's a lot of options, and we can provide some other resources or suggestions if people really feel like they've talked to their primary or their neurologist, and they share their concerns, what they really need from someone in those roles, and feeling like maybe they're not the best match, and would like a referral to somewhere else. I know in smaller communities that can be challenging because you're really left with less options and not as many people just to kind of move on to another clinic. So really, I understand that can be more challenging, and it can take maybe more difficult conversations to be really clear with, you know, if there was one or two things that would help, you know, you support me, here's what I would need. And maybe it's some of these things. So maybe it's I need more listening before you jump in and offer suggestions, or I'm a person who likes to hear all of the different options presented, and then I need to leave and come back and think about it before you suggest, you know, what is the best thing for me to move forward with. So when we actually think of advocacy, I really wanted to break it down into a couple of things, which is appointments. Some of our physicians in Portland are certainly getting the, I guess it would be, request from their larger system that, you know, appointments are about 15 minutes, and they have to kind of keep them to that timing. And so it's really important that we prepare for that appointment, because that time is golden. And so here's some things that we certainly work with our clients to do, which is all the way leading up to that appointment, we're tracking concerns, questions, issues. You have your best device, whether it's paper and pen, it's your iPhone, it's an iPad, it's a shared Google Sheet. So it's more of a digital or virtual tool, or if it's just a 3-ring notebook that everybody writes down their concerns or questions, or this doesn't seem right, or is this a side effect that we should be talking to our physician about. And then as you look at all of those kind of changes, those questions, really reflecting on, if I have 15 minutes, what are the top 1, 2, or 3? And you literally know 1, 2, or 3. Because I know I have experienced, you know, that time is so important. You want that information and need that. And so just to make sure you keep yourself on track in those appointments, or your advocate does, that you know before you go in, what are the things we're going to discuss. And then you schedule that time. And then you add time to get ready, right? The last thing we need is to find ourselves in that appointment rushed, hurried, or late, at risk. And we are noticing here in our area, more and more primaries are canceling and asking you to reschedule if you arrive. One of our docs said 5 minutes, one was 15. And so we're really trying to, and based on traffic and certainly out in the community, things are outside of your control. So adding more time and getting there early to that appointment. That certainly means then you have to think through, and I talk about the go bag, the to-go bag. You really want to be sure that's packed with your medication dosage you might need, and you extend that hour. If the appointment is an hour, generally, you want to add the 2 hours of drive time or 3, and then you want to add that a little bit more. And if you have a dose you need within that time, you want to make sure that extra dose is with you, along with water, and if you need snacks too. And certainly, if there's incontinence issues, or you might want a change of clothing, you want to make that a really robust to-go bag. So when you're on the way to that appointment, you've got that with you. That just gives you a sense of relief that I'm prepared with kind of whatever happens in that appointment. If things are delayed, I'm good to go. And then You want to bring a list of medications, and you want to be honest about supplements and any problems or changes you've had to those medications. So to the best of your ability, if they're not on your computer and you can't print them out and actually bring a printed out list, you want to have them available to you so you can review them with that medical assistance that's checking you into that appointment, and be as clear about that, because it's all of your healthcare providers' roles and your pharmacist to be able to help you and support you and look at potential side effects. But without that good list, it makes that hard to do. And then that medical assistant, as you know, is asking about what are the changes, what is this appointment for? That's the time to get out that list that you've really listed 1, 2, and 3, what's going on and what we want to talk about. And make sure you just keep staying to those 3 items. Now, it's inevitable that in some appointments, you're going to all of a sudden remember something that's different or new, and you're going to add it to the list, and you'll be left with, well, what do I focus on at this visit? And those are certainly the challenges. And then last but not least, make sure you got that driver. Do they know where to go? Have you called them the day before? If you do have a driver getting you to and from, if it's not someone you're living with, your spouse or your partner, you want to make sure your support system, especially your drivers, knows where they're going, because that's just so difficult if there's been a change in a clinic location, or they get confused and go to a different location, and then you have to reschedule. So some really good ideas about how to really prepare for that appointment. You or binder or resource, and then concerns or time is there to discuss. And then as you're going into conversation of what's going on, you want to then begin asking questions. Are there other options, with the challenges you're discussing? Are there other treatments? Are there other research? Are there other resources in the community? Is there anyone new that they're aware of? And it's so important in order to get that information is to maintain an open line of communication with either your neurologist, your primary care, to really stay focused on your concerns and be as honest as possible, express, your feelings, but then kind of keep coming back to what you're there at that appointment for. So it's kind of a balancing act between, being yourself, but as well, having kind of tracking all of the things that you want to discuss. And that really is the value, I believe, of having someone there in an appointment with you. If you aren't bringing someone into that appointment, we certainly recommend it. It's another set of ears to listen to what's being said and recommended, somebody else to process the information being shared a little bit different way, and as well, someone to take notes. That really should not be your job as the person with PD. It's really a member of your team. And your healthcare provider is taking their own notes, but you're not going to be seeing their notes line by line. You'll see that after visit summary, but as you know, it's really just a summary. And so, little things will get brought up, and I think writing those down, what was discussed and what was agreed upon, can be so helpful, because this then becomes part of your history that you can return back to later in the future. And then after your visits, we want to make sure before you leave that you're certainly tracking what your questions are. You're gathering your belongings. You're making sure if things have been ordered, you know where you're going, where the phone numbers are, and you've got the supplies to do so. So you always want to check, just take one kind of final check-in to make sure. And then again, don't forget your meds because it's so important to keep those going too. A little bit about phone calls. You know, our agency is on call 24/7. And so like appointments, it's so important if you're having to call either during the day, again, you're like your appointment, you're tracking, what are you calling about? What have you done? Is it something new, a symptom? You want to kind of give a brief synopsis because usually who you're going to get first is that receptionist. If it's after hours or weekend, it's the person on call for that receptionist. It's a company usually outside of that clinic. And you want to be very clear and succinct at what's going on, what you've attempted to do about that situation, and what you were hoping for. You potentially even can ask for a potential solution. So if it's, you know, I have a fever, I just started a new medication 2 days ago, I've tried taking Tylenol and I'm still struggling with this fever, and I'd like to know if I should continue with the medication or not. So you're giving them what the problem is, what you've tried to do about it, and what the potential solution is. And then you'd like to hear back from your medical provider. And it's okay to ask when your medical provider will get back to you and when you can expect to hear back. And then write that down. You know, so often if you have a smartphone, you can see when you made that call and made that connection with that office. But sometimes if they say 2 hours, well, either you schedule that on your phone or you kind of make a note. If I don't hear by, 3 o'clock, I need to call back. The other thing is important when you're in your appointments is to know the hours of your primary or your neurologist office. So it's very important to know when you can expect those calls. The nurse or the medical assistant in those offices are the best person to ask, what are the hours we can expect our doctor to take call? Do they start their phones open at 8 or 9? And do they close them at 3, 4, or 5? What are the days they are closed? Those are very, very important pieces of information to know so you know where your window is. And it's very hard to call that first half an hour and that last half an hour. So you want to think about kind of condensing your time that you have to reach your medical or healthcare provider even shorter based on that. Just because they have so many calls from voicemails at the first time of the day, and then at the end of the day, they're trying to get referrals out, they're trying to set up tests for people, and so they're really bogged down. So trying to think through the best time to call. And then as well to know, is my office out during the lunch hour, or is that time that I can reach them? And again, on weekend, typically you've got physicians who are covering other physicians. You might not be getting your physician. Some of them are not able to make recommendations on your behalf, especially if there's pain or narcotics involved. That's getting much more difficult. Again, so you have to be prepared to know what you're asking for and ask, is there anything else I should be asking right now before we get off the line? Okay. I think it's important to know too, if you have symptoms that are going on, asking about, you know, okay, you're recommending I do X, Y, and Z. When should I expect to have a change and to have some relief? And if I don't expect it, when do you think I should seek urgent care? Some physicians are great at giving you that information, but if not, it's really important to ask that on your own. And then the coordination piece, again, I've kind of talked about that earlier in the role in the presentation, but again, having a notebook where you track and keep together a history of all your visits, all of your legal, financial, insurance documents, copies of your insurance cards, all in one place, really helps those appointments go well and helps your care team best support you. Here's some ideas of some skills to look in at, again, and I think humor is so important and a positive outlook. Someone who feels comfortable being a good communicator, which is asking questions without blame or kind of making people feel like they're kind of on edge. So lots of clinical options out there, clinical trials. and there's so many places to look for them, whether you're looking at magazines, newspapers, PRO is a great resource, online websites, community boards, and certainly as professional organizations and associations. So many options out there to consider and be aware of. Another great role of an advocate. Urgent and emergent situations, again, these are so critical to note which provider is seeing you, what services providing, what tests are being done. If you can, get copies of those tests or at least preliminary results before you leave. That's really key and really can help you at the next appointment too. And then again, to know that you've got hand documents you're leaving with, printed paperwork, and then ensure that you know when you're supposed to call and check back in with someone. Communication, are we on the same page? It can be really challenging, especially between family members, if people have a different idea of how to approach the situation. And so taking time out, both for the good times to debrief and relax, and not have, again, so many appointments backed up so you're overwhelmed, but allow the time to be able to have honest and open communication. Certainly to be more stable, again, all these things we suggest, again, look for support, look to your healthcare provider, think about a journal, kind of track both how you're doing outside of all your healthcare appointments and to keep trying to relax and laugh and cry. So some questions that came to me that I'm gonna try and respond to here. In certain states, family caregivers can be paid. If you apply for and you're receiving Medicaid, then Medicaid does pay for family caregivers, and that's something you could talk to a case manager about. But it does vary from state to state how many hours they will pay family caregivers through the state. And then family caregivers in some states have to show they have some training. Washington, you have to show training versus Oregon, not as much. How soon we should gather our team, especially if my spouse is doing quite well. Sorry. I recommend the sooner the better because you could be in research mode, kind of gathering your team. This is a good, I think, reason to attend support groups too, to find out who people enjoy, what kind of skills do they have, what kind of communication approaches do they take. You're kind of gathering information to know who would be a good fit for us. So I'm always on the belief earlier is better. How do you educate your healthcare team? Well, certainly PRO is a great resource. They have articles. If you feel like your neurologist is not as strong in this area, you can always, if you're in a large area, look to others. But articles bringing in, I've brought in printed articles and just left them with the physician and said, at our next appointment, or even now, we've read about this, or we know about this approach. Can you, at our next appointment, can you review this and we talk about this? Or you can ask, we've seen a recent lecture about this topic. And so really encouraging your neurologist to look at some other ideas and reflect. And you'll get a good sense if your neurologist is open to being educated, or if you have to rely more on your professional association or PRO to be able to give you that support, okay? Ways to take levodopa, historically it's been, at the same time outside of certain foods, but I'm seeing more and more physicians kind of individualizing that. So definitely leave that question to your primary and or your neurologist. Requirements for hospice currently are still 6 months or less, but you have to get both the hospice medical doctor who reviews your record and your primary doctor to refer. And so 2 doctors have to sign off that you are 6 months or less and you're not looking at curative treatment. A little bit more clear when it's cancer that is the primary diagnosis, and they do need a primary diagnosis. But for example, someone can fall, have a hip fracture, and be 90 years old and decide, I don't want to proceed with surgery, and then be available and referred into hospice. Someone asked about end-of-life doulas, and these are individuals who, like hospice, but a little bit different, support people at end of life. And so they, like midwives, they midwife people at the end of life. There is a professional association called INELDA, I-N-E-L-D-A, that certifies doulas, and I would recommend you check out that association to learn more about doulas. They are in our town and are a great resource to people as well. And they can also be helpful. Some of them help people fill out end-of-life advance directives and paperwork, legal documents too. How to ask family for support or to join my care team when they are in burnout. This is definitely difficult, and why I brought that up in that early slide. Sometimes a person in burnout is not the best member of your team. The challenge, of course, is if you are limited to that individual. So I think really finding ways to kind of balance the support you do need and really kind of tailoring that based on the burnout and encouraging your family care team member to get the support and the relax or the respite they need. And really rely on your healthcare team at times when family team is in burnout, or look to larger members of community to provide you that support. I've tried to refer and talk a little bit again about how to create a care team when you're in a small town. Talked about that earlier. And does a care team include support for caregivers? If it doesn't, it should, because without our caregivers and our care team, we're really, really challenged. We really need other individuals. So yes, it should include support, especially from that social worker and nurse, but I've seen other members of the healthcare team and personal, our community support individual caregivers as well. You know, how detailed should our journals be? I like, and I've given you some examples of things that I think should be included. And then if you're doing a personal journal, I think that's helpful as well. So I've kind of rushed through this last, but if there are any other questions, I'm open as well. And thank you again for your time and attention. Libby, I can't hear you. Are you talking? So unless there's other questions I'm seeing across, thank you, everybody. Hope this was helpful.